Hi, my name is Mike. I'm a research assistant for Proove Biosciences. I work for Dr. Abdollahis full-time, and what I do is genetic testing for all his patients at no charge. The genetic test consists of a simple cheek swab for saliva and cheek cells, and we check three different things. First, how sensitive you are to pain compared to the average person, how at risk you are of becoming addicted to pain medications, and lastly, which pain medications work best for you. Looking at your enzymes and how you metabolize different drugs. That process takes about 1 minute. It consists of a quick 30-second cheek swab, and we send the specimen out to the laboratory, get the results in about 1 to 2 weeks, and you can go over the results with me either in two different ways. Either I can email the results to you, or simply come for a follow-up, and I'll be happy to go over the results with you. Thank you.
So I do recommend this genetic testing. I think it's very helpful to help me take better care of you as a patient. The test, as Mike mentioned, helps in several different ways. I want to show you the example of a test. If you look at this test right here, this patient has a opioid risk index of 10, so they have a low chance of becoming addicted to opioids. If you look down here, you'll see that their pain sensitivity index is only a 2, so they're on the tough side. They're not a wimp and they're not super tough, but they can tolerate pain relatively well, and that helps us in many ways. And on the other side, which is more important, you will see results of what kind of medications work best for them. In the case of this patient, ibuprofen and acetaminophen seem to work really well because they have a full green bar on those. Other medications like hydrocodone, which is Vicodin or Norco, does not seem to work well for this patient, so I would not prescribe that for this patient. I would prescribe him something else. Oxycodone actually, this patient is a poor responder to that because it's not going to do him any good at all. So I would not prescribe those kinds of medications. So without this type of information, we're basically just guessing as to what works and what doesn't work. And we have to do it by trial and error. You take a medication for several days and then you realize it's not doing anything, so we move on to something else. Having this information helps me to give you the right drug the first time so that you don't suffer the side effects of the incorrect drug while you're trying to recover from your surgery or from your painful condition.